News Conference. I'm your host, Rayanne Christensen. The show today is going to look a little different as we are including the governor's COVID briefing. We're going to have a few more people talking, as well as the show is going to go for an hour. We're first going to head up to the Capitol to hear from the governor.
Well, thank you. It's great to be with you as always on our monthly news conference with PBS and our affiliated stations. We thank you very much for your participation today. And we've been doing this for a very long time. And it's an opportunity for me to address the public and take some questions and talk about the current events of the day. And we appreciate the press that's involved in this effort. I recognize the responsibility that I have to report to the public. In essence, they've hired me to be the governor, and we have a responsibility to be open and transparent and talk about issues, no matter how difficult they may be. And likewise, I appreciate the role that the media plays in making sure that that information is transmitted and made available to the people at large. It helps us to inform them about the issues of the day and answer questions and hopefully give them directions. And particularly as we have this COVID-19 pandemic, which has really been a challenge for us. It's been so uncertain, it's very complex, it's frustrating, and all those rolled into one. And so we appreciate the work of the press in helping to give clarity and understanding to what's taken place. Now, let me just again thank you, particularly this past week, as we've rolled out this new transmission index. It's going to help us at least address the challenge of the surge of the pandemic and hopefully protect the health and welfare of ourselves and our loved ones, those who are around us, help protect the economy. And we appreciate the professionalism and the work that you've done in the media to get this information out this past week. So thank you for that. We're going to hear from, before we get into some questions, some special guests that I have with me today to talk about some of the pandemic issues that are important for the public to understand and to know. And let me just mention and start off by talking that there is a source of frustration, I think, for a lot of us, particularly those in the medical profession and those involved with this on the front lines. And I think the frustration comes from the fact that not everybody is responding in a very positive way as far as doing their part when it comes to helping to slow the spread of the pandemic. Many Utahns, in fact, probably most Utahns, are taking this seriously. We sometimes have questions. We don't understand everything necessarily, but they're taking it seriously. But some folks, maybe they're not as informed, maybe they don't see it from their perspective, but they're not taking it as seriously as they could. They're not doing all that they can do to, in fact, protect themselves and those around them. And maybe they don't see the medical issues as well. Maybe they don't see the business issues and the economy issues as well. But as we look broadly across the state, we all have a role to play, and we all need to do our part to do the best we can to help slow this spread down. It's all about minimizing the risk, minimize the risk as best we can until we have such time as herd immunity, which could come with a vaccine. That would be the soonest we could get it. And I think that's around the corner. But we really do need to do the best we can to minimize risk for those around us, those we love, ourselves, until we get a vaccine. Here's a couple of interesting facts that sometimes are lost in all the shuffle and the noise of this pandemic. One, most people won't die from the pandemic. In fact, in Utah, over 99% of the people who contract COVID-19 will, in fact, survive. In the United States, it's about 97%. So we're a little bit better here in Utah. I think we have better medicine, better medical personnel, healthier populations. All those things help us. And we've learned a lot as we've gone through these past 7+ months. And our medical people have been on the front lines learning and improving their procedures and their therapeutics. Many people will get infected, but will not have severe symptoms. Many will get infected and will have severe symptoms, but many won't. Some will not have any symptoms, maybe or minor symptoms. So it kind of runs the gauntlet as far as, from 0 symptoms to death. The good news is that most of us, if we contract it, will survive, but we may have some symptoms. And I'm concerned about what we don't know about the long-term impacts of this pandemic on our society and on us individually. the long-term impacts we're starting to learn, and there's certainly concern mounting about the long-term impacts. For example, I've got this memo that was sent to me from our Department of Health as the research they've done in a study, and they've said this, I'll just quote from this memo, measuring COVID-19 burden in a population is critical, especially considering the emerging evidence that some cases of all ages may suffer long-term, possibly lifelong debilitating effects after recovery from the acute disease. Significantly, these include myocarditis, which is damage to the heart muscle, pericarditis, which is chronic inflammation of the sac that covers the heart, also a propensity for thrombosis, which is blood clots, damage to the lungs and damage to the nervous system, including the brain. Now, I know along with that, we have people who've lost their sense of smell and sense of taste, either all or partially. I have a daughter who's 3 months since she was infected with COVID-19 that still does not have a sense of smell totally back. And more of a concern even to me is a 13-year-old granddaughter, 13 years old, that has lost her sense of smell and taste and is actually losing weight because she gets nauseated when she smells food. It's hard for her to eat. Some foods just she cannot eat. That's a concern for us in our own family. I know that my daughter's joined a support group. She thought, am I odd? We have groups out there, many of them, by the way, over 10,000 people supporting each other. Let's see if we can find an answer. What can we do about this to see if we can, in fact, address this in our lives and live a more normal life? So the long-term effects are something that we all ought to be concerned about as we go forward here. Let me just say, again, kind of in conclusion here, we have opportunities for us to slow the spread. I've kind of likened it to, we have accidents on the roads when our traffic, people die, people are injured and hurt in traffic accidents. We don't close the freeways, but we do, in fact, put instructions out there as far as speed limits. You should drive on the right side of the road and obey the signage that's out there, the right-of-way signs. Wear your seatbelt, and by doing that, you in fact minimize your risk when you're out on the highways. Well, that's the same thing with what we're saying today and have said for a number of months on what we should be doing during this pandemic. There are certain guidelines we should be doing, protocols, stay home when we're sick, practice good hygiene, washing of our hands, social, physical distancing, and when you can't do that, you should be wearing not a seatbelt, but you should be wearing a mask. All those things work together to minimize risk, not to get to zero risk, that's impossible, but to minimize the risk is just good protocol and practice for all of us here in the state of Utah. So I would hope that people will take this seriously and do the best they can. Last but not least, again, we all know this, this is happening. Our hospitals are starting to fill up. The bed space in our ICU units now, 20% of the patients in ICU now are COVID-19 patients. We don't want to run out of beds for the COVID-19 patients, but that's also crowding out opportunities for others that need ICU treatment and care, whether they've been in an accident of some kind or whether they've had heart surgery or cancer, you name it. If they need an ICU unit, they need to have that opportunity, and we're running out of that capacity. And so it may not be just the COVID-19 patients that are going to be in harm's way, but others that have a need for an ICU unit. And we see that now some of our hospitals are starting to delay some of our elective surgeries and postponing and putting off, which is not good for the health and welfare of the community. So this surge that's taking place and really is causing a lot of concern with our hospital associations and those who run the hospital beds. We're actually gearing up in case we need to open up the Mountain America Expo Center as an overflow area. And that causes me some concern. With that, again, we're hoping that everybody will do their best and do what they can to improve the situation. We all have roles to play, and we all could do something. And we ought to not be pointing the fingers at each other either. There are differences of opinion out there. I can respect that. But let's support each other and find ways that we can contribute to the success and the betterment of our community. And if we all do a little bit, we can all do a lot and accomplish a lot. So we're going to now turn some time over to our special guest, Dr. Angela Dunn, our state epidemiologist, will share an update on our new case counts. After that, Director Rich Saunders, Director of our State Health Department, will provide an update on our new transmission index and what we can and cannot do that we launched last week. After that, we'll have Dr. Eddie Stenehjem, the Infectious Disease Medical Director for Intermountain Healthcare, address the situation as far as what we can do on protocols and particularly information on the infection, but on why a mask works and what's the science behind the wearing of a mask. So with that, Dr. Dunn.
Thank you, Governor. So today, our rolling 7-day average of new cases is at 1,289. That's an increase of 1,500 new cases from yesterday, or about over 1,500. We're now at a 7-day rolling percent positivity of 15.5%. 301 individuals are hospitalized due to COVID-19 today, and our ICU utilization is at 73.9%, with a 7-day average of 72.2% utilization. And as the governor mentioned, about 20% of those ICU beds are filled with COVID patients right now. You know, we've seen in the past couple weeks that our healthcare system is at capacity. Our healthcare providers are overwhelmed and exhausted. Our public health system is stressed. And Utahns, we're tired, exhausted, and we're scared. And I get it, we get it. But the doctors, nurses, public health practitioners, the researchers developing a vaccine, we're all coming to work every single day to protect the lives and livelihoods of Utahns so that we can move towards a time when we don't have to worry about this anymore. And, you know, I don't know what to do anymore. We as a state, we have set the table. We're prioritizing and focusing on individuals taking responsibility to slow the spread of COVID-19. And we're heading into the colder months where people are going to be inside, having holiday get-togethers. It's now flu and cold season, where every year we stress our hospitals during this time. You know, I'm really not trying to scare anyone. I'm just trying to inform you of what's going on and give you the facts of where we are in this pandemic. We're working from home. We're wearing masks. We're staying away from each other, practicing physical distancing. We're getting tested for COVID if we have any symptoms. And we're doing this to save lives and livelihoods. And this isn't going to be forever. You know, I can't predict how long we're going to have to be doing all this, but I do know that we will get through this, and we'll do it by coming together as a team and supporting our leaders, our healthcare providers, and each other. Thank you.
Thank you, Governor and Dr. Dunn. I have the good privilege of working directly with both of these individuals, and I will say that the integrity is high and the care is high on these two. I know some people are very critical of what's going on, and I will say that behind the scenes, there is great integrity, and I hold these two individuals in the highest of respect. And Governor Herbert he takes on a lot from all sides. He's very tough, and he's filled with integrity and goodwill to serve the people of Utah. As Dr. Dunn stated, there is a need for us to come together, and the method that we've rolled out to formalize this coming together was the transmission index that we announced last week. And today I'm going to make an announcement that deals with the shifts in different counties. The public without public awareness and public participation, as was stated by both Dr. Dunn and the governor, the transmission index is of little value. We need your help. And I don't think we're asking a lot generally at this point in the pandemic. The type of awareness that we're talking about today, for example, we met yesterday as a group and analyzed the data just to make sure that the data was accurate. And based on the transmission levels, that the criteria that we talked about last week, There was an email that was sent out to county executives, and today there will be an email that'll be sent out to city leaders and partners in the education and chambers of commerce announcing this information so that everybody has clarity as to what the transmission levels are in the counties. We're also engaging in weekly webinars with businesses throughout the state, organized by the Utah Association of Counties, and the index levels will be displayed on the Utah Department of Transportation by the UDOT on their electronic highway signs throughout the state. And then we will engage in robust social media pushes with county-specific information. And this is all done so that people have information, so that they will know what the transmission level is in their county, so that they can make adjustments in behavior. And again, that last part, adjustments in behavior, without that, we don't have much. So we consider you all our media partners. And anything that you can do to help socialize these concepts and these principles is greatly appreciated, and it will make a big difference. So today I wanted to announce the counties and their transmission levels. 16 counties have changed levels this week. 13 counties went from moderate to high. 2 went from low to high. 1 went from low to moderate. So the counties in high are Beaver, Box Elder, Cache, Carbon, Davis, Emory, Garfield, Grand, Juab, Millard, Morgan, Salt Lake, San Juan, San Pete, Sevier, Summit, Tooele, Utah County, Wasatch County, Washington County, and Weber. Those are the counties that are now in high according to the 3 metrics that we use in the transmission level criteria. Moderate counties include Duchesne, Iron, and Uinta. Counties in low include Daggett, Kane, Paiute, Rich, and Wayne. All of this information is available at coronavirus.utah.gov. And we invite you to go and look at the detail there. So what does this mean? And the governor and Dr. Dunn have both commented on what we're asking. For high and moderate, it's pretty simple. Casual social gatherings are reduced to 10 individuals per gathering. And this is in high and moderate right now just because of the circuit breaker that was introduced last week. And that is in place until the 29th of this month, after which the gathering size will change, the social gathering size. So casual social gathering size reduced to 10 is done so that we can reduce the transmissions that are happening in those settings, which are significant. Masks need to be worn in public settings in high and moderate under the circuit breaker, such as stores, libraries, and restaurants when you're not eating and drinking. Restaurants and bars must have 6-foot distancing between parties in waiting and seating areas. And those are the main behavioral issues that we're asking for in high and moderate. Across all levels, in large public gatherings with oversight, masks are to be worn in all transmission levels. Physical distancing is still encouraged between household groups, hygiene practices, and then following the isolation and quarantine guidance. The governor spoke of it, staying home when we're sick or when we've been exposed to a close contact. Here's what it also means. Businesses may continue to operate safely. There is no close down. We're high transmission levels, and we're asking for individual participation, as Dr. Dunn stated, but businesses may continue to operate safely. People need to continue to live life to the fullest, but with an extra measure of caution and awareness that comes by virtue of the index that we are sharing each week. And is that cautiousness is demonstrated by the things that I've just reviewed and that you've heard the governor and Dr. Dunn mention. Nothing new, just simple practices. If you're sick or have been exposed to someone, follow the protocols. People are encouraged to continue to be productive and to stay connected with each other. We're not asking or promoting isolation socially. We're promoting distancing and wise practice of use of masks and smart thinking when it comes to getting together. Those who are at the highest risk levels for illness, which means if you have underlying conditions or are of advanced age, we're stating very clearly and boldly to be very careful and cautious. And those that associate with those individuals also, or in work or in personal private settings, we need to also be careful when we go around them, that we take extra precaution in how we interact with them because they're more vulnerable. So in conclusion, we know counties will be able to get back into the moderate and the low because we've been there for so much of the pandemic in much of the state. People have expressed that we've established these thresholds that are too stringent, and therefore the counties will not be able to reach those levels. And I'm just stating, based on the data, that that is not true, that counties have been very familiar with these levels and that they can obtain these if we work together, as the governor asked. We know we can work together to slow the spread. I would also invite you to invite others to be more cautious and engage in this activity, in the transmission index and the behavior that is associated with it. Without you, we cannot accomplish the goal, which is to make it safely through and achieve the herd immunity, which comes from vaccination and natural transmission. The vaccination is, by science, the safer direction for herd immunity, and that's what we're striving for. So we want to engage all of you in that end game, which is to make it safely through until this becomes a little more normalized. So thank you for your time and your support and your cooperation.
Thank you, Governor, for having me, and thank you for bringing in healthcare experts from the state of Utah. It's my pleasure to be here today. This morning, I led Intermountain Medical Center's COVID-19 rounds. These are rounds where an infectious disease expert reviews all the patients at Intermountain Medical Center. This happens in all of our hospitals across the state, and ensures that patients are on the most appropriate therapies for COVID-19. Over the course of these 2 hours this morning, I spoke with the treating physicians for dozens of COVID-19 patients at Intermountain Medical Center. Patients in our hospital ranged from 19 years old to 90 years old. Approximately half of them were in the ICU. All of them are suffering, they're alone, and they don't have the comfort of their family or their friends nearby. Many won't make it, unfortunately, and some will make it and be left with chronic medical conditions like the governor mentioned. I wish I could take all of you with me on these rounds. These rounds teach you the respect you need for this virus. And hopefully our video last night that we released gives you a sense of what it's like to care for these patients through the lens of a caregiver. I wish today I was coming to you with good news, really any good news at all. Unfortunately, I'm not. Our cases are at an all-time high. Our hospitalizations are at an all-time high, and will continue to rise if this trend in cases continues. The percent of tests that are positive is the highest we've ever seen. 18% was released yesterday, indicating that we are missing many, many infections. We just heard that 16 counties today is going up in risk level. All of this, as we head into winter, head into influenza season, where we typically stress our hospitals at baseline. And we are now moving inside as the weather gets colder, in places with poor ventilation, more exposure to people, and we're surrounding ourselves with friends and families as we celebrate the holiday season. All of this will drive more infection. For the first time as a physician, I'm scared to see what's to come. I'm scared about the next few months that we will endure here in Utah, unless something changes. Intermountain has been preparing for a surge in these patients since the pandemic started in March. We are now putting into action those plans to accommodate the rising numbers of cases that we're currently seeing throughout our hospitals. We continue to load level our patients across the system, ensuring we have our patients spread out across our hospitals to ensure we maximize our beds and our caregivers efficiently. Just this week, we had to open a new surge ICU to care for patients at St. George Regional Medical Center in St. George, Utah. On Wednesday, LDS Hospital and Intermountain Medical Center began transferring some non-critical and non-COVID patients to the Orthopedic Spine Hospital in Murray. This allows for more COVID patients to be treated at IMC and LDS hospitals, where we have experts in ICU medicine, hospital medicine, and infectious disease. We will next be transferring pediatric patients from Altaview Hospital and Riverton Hospital to Primary Children's Hospital, so Altaview and Riverton can accommodate more COVID-19 patients in their facilities. We did a trial run of this in April, and we're ready to move forward. At this point, we have the resources to care for the complex COVID and non-COVID patients across the state. That said, our healthcare system is being stretched thin, and soon there will be a time when we may not be able to provide care for all those who need it. Our caregivers personally saw this happen in New York City, and we've now seen it play out in the news in Arizona, in Florida, and all across the globe. We know we don't want to get to that point where we can't provide the highest level of care that we know we can. The day is coming, though, and unfortunately, the day is in the not-so-distant future if we continue at this pace. The most valuable resource we have in our healthcare network is not beds, it's not hospitals, it's not medicines, it's our caregivers. Our highly trained caregivers are putting themselves in harm's way every single day. Our nurses, our physicians assistants, our nurse practitioners, our pharmacists, our respiratory tech, our researchers, our environmental service staff that clean the beds, clean the rooms when people leave. All of our staff have come together to attack this virus head on, and they're standing strong and they're standing united, unlike our state and our nation at times. However, as cases climb, our caregivers are becoming stretched thin as we care for more and more COVID-19 patients, and we're asking more and more of them. Our caregivers are tired, they're emotionally spent, and they're frustrated. And sometimes they're even angry when the situation we find ourselves in. They're frustrated when we see individuals and communities and occasionally local governments not heeding the advice of scientists and public health experts to follow simple public health measures. Wear a mask, keep your distance, wash your hands, and avoid large gatherings. We are saddened by the loss of life and the suffering endured by our patients that could have been preventable. So where do we go from here? We've called on the community many times before, and we're doing it again today. We need your help. The message is the same. The science hasn't changed. If you've had any symptoms of COVID-19, regardless of how mild they may seem, get tested, stay home, and self-isolate until you have your test results back. Always wear a mask when you leave the house. Masking is the simplest approach we can take to change the trajectory of this virus. The science is clear, masks work. When two individuals wear a mask, it is virtually impossible to transmit the virus between them. It's not zero, but the risk is greatly reduced if both individuals are wearing a mask. We know the virus is spreading through social circles, even with people that we're comfortable with in our social day, everyday life. But we need to wear a mask at all times, even in these encounters. Masking will break this chain of transmission and slow the spread of this virus. We also need you to minimize close contacts as much as possible. And if you choose to socialize with people, try to do it outside. And if not possible, wear a mask in the house, open windows for ventilation, and do what you can to minimize the risk. And always continue to wash your hands. We also call on our public health officials and our state leaders. Take the appropriate action to mitigate the spread of COVID-19. Don't let COVID threaten the viability of our state healthcare system. Don't let our hospitals get overrun. If that happens, we've failed. Be bold and take decisive action to protect your citizens, even if that's not popular. Given all that's happening in the US right now, it's hard to look forward to the future. Our morale is low. It's hard to be optimistic, but we have to. We need to develop a unity of purpose in this state. We need to come together as one. We need to rally behind this singular goal of protecting the health of our citizens. Now is the time. We are being tested, and if we fail this test, Our health systems may not be there for you when we need it most. Thank you.
Thank you, Dr. Stenehjem. We appreciate your service and all those out there on the front lines doing so much at a difficult time. Thank you, Dr. Dunn, as our state epidemiologist, and Director Saunders for your work at the Department of Health. Let me ask, before we go on to the question, just to summarize again. The concern that I think we all face today is the trend that we see with hospitalization rates going through the roof. It should cause us all concern with our ICU units being occupied by COVID-19 patients, and that has the potential to push out others who need it, delaying elective surgeries, and others who have a need for an ICU unit. It's not just the rooms either, as has been mentioned. It really is the personnel to man our ICU units, which is stressed. And what we have going on right now is not sustainable. So we need to change that direction. That requires all of us to participate. We have a good plan in place, but it's only as good as how much we're willing to, in fact, modify our own behaviors. And no matter how good it is, if we don't change and comply, the trend will continue to go in the wrong direction. So again, the urgency, I hope we all can sense and feel. I do want to give a shout out to our business community. We really don't find problems at the workplace. And in our business community, they've done a good job of making it safe, an environment for employees to come to work and for customers to come and shop. And so that really is not the issue right now. It's our social interactions, getting together in larger groups. That's why we've asked for the 2-week period for even those in moderate transmission rate index to avoid having casual interactions with family, friends. If you do have 10 members or less, we're finding, in fact, doesn't matter if you love each other and your family or friends, that doesn't make you immune from getting the COVID-19 virus. So again, we're asking for some sacrifice, particularly as we come into Halloween and then into Thanksgiving. It's just something that you need to be cognizant of and minimize the risk to yourself and your families by minimizing those social gatherings. Again, I'm sure we can do this, as has been mentioned by everybody, doing this together. We all do our part. We can bend the curve and reduce the numbers of infections and, in fact, open up opportunities in hospitalization for those who need to use the ICU beds and the personnel, which are stressed. They're overworked, and that's a real challenge. It's something that's hard to see, but it's happening. It's a real situation we've got to avoid. So with that, through the miracle of technology, we're going to see if we can try to answer some questions. So we'll take a few minutes for some questions.
All right, thank you, Governor. We're first going to take some questions from some reporters here in the studio.
Governor, is there any more that can be done policy-wise? You've asked and asked and asked people to do the right thing, and clearly people are still gathering in groups. They're still not practicing physical distancing. They're still not wearing masks. So what can you do policy-wise to get them to do it?
We put a policy in place that I think will work. Again, it doesn't matter how much government demands or makes it a law or a rule. People break the speed limit all the time. We have accidents. People don't wear their seat belts all the time. They have accidents. There's a lot of bad behavior out there. So I don't know if there's anything that can guarantee or ensure. It is, at the end of the day, are you willing to, Ben? Am I willing to, Gary? All of us willing to, in fact, do our part by following proper protocols to minimize risk to ourselves and to our loved ones and to the community at large. If no matter how good the plan is or what we put in place, if people won't comply with it, we're going to have a trend going in the wrong direction. So again, short of locking people up and putting them in isolation, I guess in some kind of prison state, which I think has its own set of consequences that are all negative, I don't know what else we could do other than the plan we have here now, which we're trying to minimize risk until we in fact get a vaccine in place, which hopefully will happen maybe by the end of the year, the first of next year, which will help us to get to that herd immunity. And so, again, the wearing of the mask, people complain about the wearing of a mask covering, and yet that's probably the easiest thing we have to do, certainly the least expensive thing we have to do, and and it does not negatively impact the economy. There's not really any reason you can't shop and enjoy life and participate and wear a mask at the same time when you cannot physically distance. Again, it's really a simple thing to do, and we have mandates in place now across the state. This has now been taken out of my hands. We have transmission rate categories, and so the local health departments and the local elected officials are going to be held responsible for making sure that there's enforcement in place and that people are complying. Otherwise, they're going to have increased spiking of infections, which I don't think anybody wants to have. Next question.
Governor, it's been a month since Utah County implemented their mask mandate, and this week they since let that mask mandate expire to move under the state guidelines. I guess this is actually more a question for Dr. Dunn, but from a data standpoint, what can be learned from that mask mandate, and what sort of an impact did it have on cases in Utah County?
Good question. Thank you, Dr. Dunn.
So Utah County is a great example of what can be done through policy and goodwill of the people. So they put a mask mandate in place, and they went to orange for Provo and Orem. I cannot get my mask off okay, there we go. So Utah County is a great example of what can be done. They put a mask mandate in place. Provo and Orem went to orange under the old guidelines. And a couple weeks later, we saw the cases starting to decrease. So those measures worked. And the fact that they're coming under the guidance of the new transmission index is to keep everybody on the same page. And they're still in high, so they're still going to have that mask mandate in place. And we know it's working there. So we urge all the 15 other counties that are going into high to really take that lesson from Utah County that these measures work. They decrease the number of cases, which decreases the number of people hospitalized in the ICU and ultimately die. So it is a very important measure that we should all take very seriously.
We do have some reporters that are joining us remotely. We would like to go to Chris Reed with the St. George News. Chris, go ahead with your question.
Thank you so much, Governor. I know you like to speak in terms of football terms. You've compared this to being halftime of a game, basically. And something else people like to do is Monday morning quarterback. So looking back at all of your decisions since the pandemic began, what kind of decisions, looking back, do you think you should have done that you didn't? And what decisions have you done that you look back on that you wouldn't have done the same things now?
Well, that might take me a little time to kind of sort through all the things we've done. There's been, a lot of different machinations of this plan. We had, as I'll remind you, we had on the Utah Leads Together plan, we had 5 iterations of that. Probably the most comprehensive plan in the beginning of any state in America. And we had good success, by the way. I think one of the mistakes we made was, in fact, saying it was at low risk to high risk. We had red at high risk, and then we had orange, and then yellow at moderate risk, and then green was really at no risk, when in fact there's always risk. We probably labeled that incorrectly and probably sent a wrong message to the public at large, thinking if we got into these lighter colors that somehow the risk went away, when in fact it was just a smaller transmission rate. So we have it labeled correctly now. I think we should have empowered more the local governments and the local health departments to make the decisions rather than have it funneled through my office. And I'm not the pandemic czar. This really is a matter of health, and our health departments really are best equipped to analyze the data and make determinations as far as what the transmission rates are in the different localities. We've tried to respect, and I think we did a good job in this regard in respecting the regional differences. We've unfortunately seen in some of the regional differences, politics play a hand in the decisions being made. And we said in the very beginning, we didn't want fear to drive us, and we didn't want politics to drive us. And I think, unfortunately, sometimes that's happened on both counts. We are trying, in fact, as we have said earlier on, I think what we've done right, at least as far as the goals and the concept, is to, in fact, find a balanced approach where we protect the people's health, do the best we can under a pandemic and under a situation we've never seen before, As I mentioned, using your analogy, there's not a game plan, there's not a playbook out there for us to follow. We've learned along the way through this first half of this contest, which we hope is going to improve us in the second half to have better outcomes. But we've had, I think mistakes made along the way when we've had too much political influence and maybe too much fear influence. And we need to make sure that what we do is to protect the people's health and welfare, as well as make sure we protect the economy. The CDC's come out recently and said, again, a mistake they had, and it has been made by many other states, not Utah, by the way, in closing down the economy with its own set of problems and challenges that have a significant negative effect on the community at large. On balance, we've done pretty good. We've learned along the way, and we're doing better. We're in a surge now, which is, by the way, not unique to Utah. There's about 29 other states that are having the same surge and same kind of a challenge. Some are much worse than we are. Some have been better and now are worse. So I think everybody's having their turn. It is really a frustrating fight we're involved with here. And as I said before, it's kind of like whack-a-mole. We get something figured out and punch that down and something else pops up on the horizon in another arena. But again, all of us do our part. I'm very confident we will survive this, and not only survive, but thrive as we go into 2021.
Okay,
Next question.
We would like to go to Bethany Rogers with the Salt Lake Tribune. Bethany, go ahead.
Governor, during this press conference, you've really been imploring people to wear masks as a way to contain the virus, but we've seen throughout the pandemic that the fact that masks have become a political issue is one thing that's inhibiting people from adopting mask wearing. What would you say to the president and to local leaders who have contributed to making masks a political issue?
Well, it's unfortunate that anybody makes it a political issue, and it's happening on the left and the right. Nobody's probably immune to this, certainly on the national stage. And there's been uncertain sounds and recommendations given to us. The CDC at one time said, the masks were not helpful. Now they say they are. That's a change of position, which sends an unclear signal to the people at large as far as what is the right protocol? What is the science behind it? We've tried to sort through the stuff and make sure that the information we give to you from the states has been accurate and factual. We've tried not to have any bias politically at all, but with our goal of having a balanced approach. I've talked to the president and I've talked to the vice president personally about this and some of their staff members and saying, you can lead by example by you showing up and wearing a mask, showing that people it's okay. I can't account for others' behavior. We're trying to do the best we can here in Utah. And in large part, we've succeeded over these 7 months. We're in a difficult situation here these last 4 to 5 weeks. And we're trying to do something about it. It's going to take all of us combining our efforts, setting aside politics and doing the right thing for the right reasons. We're compelled by law to do it, but we ought to do it anyway. We've had religious leaders throughout the state say, please wear a mask. We had the business community saying, stay safe and sign a pledge that we're going to make sure our environment is safe for you to come and shop, and have thousands of businesses joining the cause to make sure they have a safe environment. So business leaders, we have the medical people right and left are telling us, here's what the science tells us, here's what the medicine tells us. And yes, there may be some minority opinion out there that maybe is worthwhile of being heard, but when you have 95% of the medical people saying in one way and 5% saying a different way, generally speaking, we're wise to follow the 95%. And that's what we're doing in Utah, taking the best medical advice we have, the best minds, the best thinking, developing a plan that we have in place now. But it's only as good if we're willing to, in fact, impact the plan by our own behavior. That's what we need to do, and I hope that we will do it. Time will tell.
Okay, we'll take some more questions from reporters here in the studio.
Governor, Ariel Harrison with KUTV here. With our rising case counts, I know it was talked about and discussed of the Expo Center here in northern Utah being an option should we go over capacity. Are all areas of our state, in addition to the information the expert with Intermountain shared about opening additional facilities, are all areas of our state prepared to open additional hospital areas for those patients if they get to that point?
Yes, we have backup plans in place, but I'm going to let somebody, Doctor, you want to speak to that issue?
Yes, within Intermountain Healthcare, we have multiple phases of our surge capacity to accommodate the increasing number of cases and hospitalizations of COVID-19. We are scratching the surface of really implementing those surge plans, which I outlined here previously. I think what we really need to highlight, however, though, that we can have surge plans to expand our access to hospitals and to hospital beds. But once we get to that point where we're going into the expo center or we're really increasing our capacity across the state for hospitalizations, is that our caregiver roles will change. And so instead of being cared for by an ICU-trained intensivist who has spent their life training and practicing their craft of ICU medicine, you may be being taken care for by a physician that doesn't have that specialty training. They may be supervised by an intensive care unit physician, but they are not one themselves. And we're going to see that across the state. And so we really do not ever want to get into the situation where we're going to be dependent on these types of surge practices, because we just do not have the advanced healthcare workers to be able to manage these patients most efficiently and most effectively to continue to have our low mortality rate that we're fortunate to have here in Utah.
Okay, do we have more questions from the studio?
Governor, are you having any discussions with the legislature possibly about law changes or any other things that you need to see addressed to try to get a handle on this surge?
I meet with the legislature leadership, the president and the speaker, once a week. I saw them again last night. We didn't have much of a conversation. It was another function, but I'll be meeting with them, I think today or tomorrow. So we'll have ongoing discussion. We give a report on where we're at, where we're trying to go, the trends that are taking place, if there's any laws that are inhibiting our ability to function, some suggestions that come to us, from people outside of our little circle to see if there's something we need to incorporate. So there's ongoing discussion, and there might be some things addressed in the upcoming general session as far as emergency powers and those kind of things, which we've had discussions on. This is a unique situation. It's not like an earthquake or a fire or flood. This is a long-term exercise, and how we, in fact, deal with that under emergency declaration situation is one of concern for all of us.
Governor, when you say that there's really not a playbook for response here, in addition to the red state and blue state data that we collect, there actually is a playbook that's evidenced in the Pacific Rim countries and especially New Zealand. So what is it that makes mandates so difficult from a statewide level?
Well, I think in a conservative state like Utah, there's a lot of people that don't like government telling them what to do. We're pretty independent in that regard. We have people that, in fact, rebel against government telling them what to do. And that's how do you thread the needle to make sure that we don't overreach. We've tried to not use government as more of a velvet glove, a softer touch, as opposed to a hard hammer type approach. Different states have different approaches, and I can tell you, as you look around the country, I don't know about New Zealand. That's a little bit exotic for us, but we see around the world. But particularly, we have a unique system here in the United States called the United States of America. 50 different laboratories of democracy, 50 little different pilot programs. Each of them have had success and failure along this pathway. Each are trying to find the right magic formula to, in fact, solve the problem. And with varying degrees of success and failure, we find that nobody really has found the formula yet. Some that have been held up as an example, have had high death rates. New York is an example of where the case rates are now down, but they have 170 deaths per 100,000 people. In Utah, it's about 15. Now, do you want to trade deaths to have a lower case rate? Some would say yes. If you die, you die. Just let it rip through the community. I don't know, that's the calloused approach that we'd want to take here in Utah. We care about our senior citizens and those who are vulnerable that deserve a longer life. We have others like South Dakota that have just been wide open. And they say, look at us, look how great we've done. Well, if we follow the same pattern of South Dakota, not to pick on any of the states, by the way, but one's a Republican, one's a Democrat state, if we had the same numbers of infections and death rates at South Dakota, instead of having 540 or 50 deaths that we have in Utah, we'd have about 2,200. So I'm not sure that South Dakota is such a great example either. Not to mention that they're smaller in size, about 850,000 people in the whole state, and social distancing is a norm for them there. So again, we learn from each state and trying to find out what works and what doesn't work. And we have varying degrees of success as we try and try again. Bottom line, though, is what we do know works is proper hygiene. Don't go to work when you're sick. Have physical distancing of at least 6 foot. And when you can't, then wear a mask. If we could just get people to do those simple things, we would make an about face on the trend we're facing today. It's not that hard. It's a matter of us committing to do it. And I hope that the people understand the seriousness of the issue, that what we have going on right now is not sustainable. It should cause us all alarm. And we need to take our steps to be careful and do the right thing.
I have a question from Jordan Burrows from ABC4. He asks, yesterday the CDC changed its guidelines for what it means to be in close contact with someone who has COVID-19. It is more stringent. It changed from 15 consecutive minutes to a total of 15 minutes in a day, including brief encounters, 1 to 2 minutes at a time. How does this change the state's response to COVID for places like schools, jails, nursing homes, places of worship? How should they adjust?
Let me ask Dr. Dunn.
So what we have to recognize here is that risk of getting COVID is a probability. You could be only 30 seconds with someone and they cough in your face and have COVID and you can get COVID. So the idea of putting a 15-minute over a 24-hour period is that you're more likely to come in contact with COVID over multiple times, and that increases your risk. 15 minutes at one time is not the standard. How it impacts our response is definitely in like the school and workplace setting. For example, today I learned that there are some schools who, for example, had recess for 12 minutes because it was shorter than the 15-minute period. The goal here is now to cohort people as much as possible so that you limit the number of people you're exposed to throughout the day. So keeping your exposure small, your exposure number is small. So for example, keeping the same 10 kids together all day rather than having them interact with different kids throughout the day is going to be important moving forward. Again, this is the best evidence that we have to date after learning from a prison outbreak that staff in the prison who were wearing full PPE while caring for inmates throughout the day, even though they were never with an inmate for more than 15 minutes, they still contracted the virus. So that shows us that it is kind of that cumulative effect rather than the consecutive effect.
Another recommendation from the CDC, they have recommended to avoid trick-or-treating for Halloween. This is coming up next weekend. Our numbers are pretty bad, and I know, Governor, you've said to use common sense. Now, this could be a very potential high-risk transmission day. Now, what can we say to people when we're seeing these record numbers right now? Why not go with the CDC recommendations?
Well, again, we want people to enjoy life. We don't want to have things so shut down that you cannot do anything, you can't wiggle. I think with proper protocol, and parents are going to have to make this decision themselves for themselves and for their children. We certainly would say if you go to a door, you not go in large groups and you wait for a group ahead of you to finish at the door before you go up so that you don't mix together. We've asked those who are involved in trick-or-treating, those that provide the candy, to do so in sanitized wrappers or containers so that they don't have a problem with, in fact, the product, the candy that the children will eat later. And we've asked parents to bring that candy home and take a look at it before and examine it to make sure that they feel safe. And if they need to sanitize wrappers, they can do so at their home. So we think there's a way to do it where you can be safe. And so we would encourage people, again, it's just mostly common sense, but we think we can do it.
Okay, and I know that it's about another week before we know about those new restrictions and risk levels that have been implemented statewide, but we did see all of those counties move into the red and higher warnings. So do you guys both, I think maybe we can hear from both of you, do you guys think that it's working? Because it kind of appears that it may not be. Will you both let us know if you have confidence in it?
Well, one of the real challenges with the pandemic and what we face here uniquely so is the lag time. You do something and you don't know whether it works for 2 or 3 weeks later. And the ramifications of those policies are not easily ascertainable. And, sometimes we have a trend that goes opposite of the direction. We don't know why, an outbreak at some place. So it's hard, in fact, to know the cause and effect exactly. But over time, that's why we have a 2-week trend. And we look at the 2 weeks, and it kind of modifies the ups and the downs of the data so we can understand more clearly what's taking place. But science is telling us, again, it's become a broken record. Proper hygiene, don't go to work when you're sick, social distancing, not large groups, wear a mask when you can't. If we do that, we'll be able to bend the curve. That's what the science tells us today. So with that, Dr. Dunn, would you like to add to that?
So typically with policy interventions, it does take 2 to 3 weeks for us to see the impact on our cases. So we're watching those closely. We're 1 week into the transmission index being applied. Over the next couple of weeks, we'll continue to evaluate it. In the meantime, kind of thinking about what those next steps are. I just want to touch on Halloween as well. I think the biggest risk for Halloween is, of course, the gatherings, right? What you do before you go trick-or-treating, what you do after trick-or-treating. So it's really important to stay within your household and wear face masks when you go out.